wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for this podcast, which is produced with support from MD Coaches, a company dedicated to developing and empowering physicians to realize a greater potential and achieve a greater level of satisfaction in their chosen roles. Today, it will be my pleasure to speak with Dr. Patrick Vinck, who is a family medicine physician in Phoenix, Arizona. Dr. Vinck received his undergraduate degree in 2007 from the University of Arizona, where he graduated magna cum laude with a degree in biochemistry and molecular biophysics. From there, he went on to medical school, also at the University of Arizona, where he received his MD degree in 2011. And finally, he completed his residency training in 2014 at the Family Medicine Residency Program situated at St. Joseph Hospital and Medical Center. Currently, Dr. Vinck is the Arizona Medical Director for POP Healthcare, which is a home-based primary care model caring for a vulnerable long-term care population. Dr. Vinck is responsible for improving the clinical care of more than 2,000 lives through strategic oversight of quality, utilization management, and redesign of the primary care delivery model to meet the needs of patients and insurers alike. He is also a champion of the patient experience as well as provider engagement. Dr. Vinck also describes himself as a tech entrepreneur. He is involved in the development of a new and exciting medical device, which we will talk about in detail later on in the interview. So now let's hear my conversation with Dr. Patrick Vinck. Well, Dr. Patrick Vinck, welcome to Prescription for Success, and thank you very much for joining us today.
Thank you so much for the opportunity. It's real exciting to be here.
Well, it really is a pleasure to have you, Pat. You have been very busy for a young man, and we have a lot to talk about, a lot of things that I would like to get to. So if it's okay with you, I'm going to kind of start at the beginning. I was looking through your resume, and I noted that you have an undergraduate degree in biochemistry and molecular biophysics from the University of Arizona. And if I looked at that, if somebody had told me at a cocktail party that they had a degree in molecular biophysics, I think I would have guessed that that was somebody that was probably on their way to a PhD in perhaps bench research or something of that nature. So I'm curious, was medical school always your target, or is that a decision that came later on?
That's a really funny question. I think I started off college thinking I was going to be a pilot, and then I thought I was going to be a chemical engineer. And I quickly learned that a lot of chemical engineers spend a lot of time working on oil-related businesses, and that wasn't quite as interesting to me.
Okay.
And I wanted to do something that really impacted human health, and I thought learning more about biochemistry would help me get there. So I was really fortunate to have a really great program at U of A. Math was also kind of one of my interests, and luckily there's a lot of math involved, and so that helped me out.
And did you actually come to that decision during your undergraduate school, or beforehand, or how did that come about?
It did, yeah. It was about halfway through, and then towards the end of our freshman year, and I just realized I really enjoyed engineering. I love the components of it, but I thought biochemistry would help me learn more about human health.
All right. So you finished there with honors, magna cum laude, and got yourself into medical school, which you finished successfully in 2011, I believe. And once again, you make a decision to go into family medicine, And I would, once again, probably have guessed with your undergraduate background and your interests in that area, I might have predicted maybe medical oncology or endocrinology or something more related to molecular biology. So how did that decision come about?
To be honest with you, that's exactly what I was thinking of going into as well, as an oncology field or something similar. I was always really interested in what the kind of more advanced sides of medicine are in terms of technology and development. But then going through medical school and then towards the end of training, I realized that what we really need are also technologies and kind of systems and operations in medicine. And while we talk a lot about advancing technology, I think there's a lot of technology that's needed in how our clinical workflows operate and things like that. And I also kind of have a passion for underserved populations. And, family medicine is really rooted in caring for not only the whole family, but also in caring for underrepresented populations.
I think that is really a really brilliant way of looking at the delivery of healthcare as a whole, and something that I think really does get overlooked, which is exactly what I think you're saying. We seem to look at the generalists as a not as disciplined, not as scientific branch of medicine. But if you look at the big picture, particularly with population health studies and high-risk populations and things of that nature, there really is a place for the mathematicians and people with your background, would you say?
I believe so, and that's really where my career has kind of been focused. There's a lot of importance, obviously, with specialty care, and it's super needed. But at the end of the day, we also need a strong primary care system to facilitate appropriate medical treatment. And so I think that there's a real opportunity and for us as a nation to really invest heavily in this space.
Well, excellent. And I think the primary care healthcare community is very fortunate that you took an interest in what they're trying to accomplish.
It's very generous of you.
So 2014, you finished your residency in family medicine, and now only about 5 years later, you find yourself as the medical director, or at least the Arizona medical director for a company called Pop Healthcare. Is that right?
That's right.
Well, Tell us a little bit about Pop Healthcare. How does that work?
Yeah, so if Pop Healthcare is a really fascinating organization. We take care of a very sick group of patients in Arizona on their Medicaid long-term care plan. So we're a home-based primary care delivery model, and we're led by nurse practitioners, and they're the primary care providers for these patients. And we go all over Arizona to take care of these patients, and usually they just can't get to their doctor's appointments, or they just need someone to help coordinate their care very closely. And so we're a pretty unique model. There's other parts of the organization that do a slightly different model, but we're the primary care physicians in Arizona. And we have a full back office staff supporting the team. We have RNs as well. We work really closely with the case managers, and it's really a collaborative model to take great care of patients that are very sick and really need the high intensity care.
Well, that really is a really important place for particularly this country to be focusing on healthcare. Many years ago, when I first established my practice in Montgomery, Alabama, I was getting to know some of the doctors in town, and the conversation always turns to how we go about doing what we're doing, and what the healthcare system in America is all about. And one very wise gentleman said to me, Randy, we don't really have a health care system in the United States because we wait until people become unhealthy before we try to do anything about it. What we have is a disease care system. And it sounds like Pop Healthcare is trying to do something about that very issue. Would you agree?
Definitely. Yeah, that's a great point. I think our system is designed to take care of sick care, not so much health care. And across the spectrum of care, I think highly underinvested in preventative care, and I think we unfortunately see the downstream effects of that with our ever growing healthcare costs. But we're certainly focused on providing the highest quality care to this patient population. It's a real joy every day.
So that's the focus of Pop Healthcare. And as I understand the organization, and please correct me if I'm wrong, it appears that Pop Healthcare is a privately held
Actually,
company.
they got bought out a few years ago by Guidewell, which is a privately held group. But yeah, we started here in Arizona about 5 years ago, and then grew the business, and then now it's pretty well established here in Phoenix.
But it is investor owned.
That's right.
So there were people that felt that the idea was worthy enough to put some capital into it, and that being the case, and being that it is still in business, I'm going to assume that you all have some statistics that indicate that this is actually working out.
Yeah, that's right. Yeah, absolutely. So, the statistics we closely monitor are, our outcomes, right? Our business model is very, very much based on outcomes. And so our partners look for us to improve metrics like hospitalization rates, readmission rates, ER visits, and also, then your HEDIS measures, right? We're very highly focused on outcomes. So diabetes control, blood pressure control, all the typical metrics. So we've been very successful in those endeavors, and so that's part of the magic mix for the success of the organization.
Well, it really sounds like a good idea, and it'll be very interesting to me to see if it will spread. I think it certainly would be good for American healthcare in general, because in spite of the fact that you all clearly have had some success with this, it appears to me that the footprint for preventative care organizations in this country is relatively small. Would you agree or disagree, or you have different ideas on that?
No, I definitely agree. I think there's a growing group of organizations that are really trying to tap into this market, which is really exciting, because I think there's a lot of need for it. To your point, is there a way that for us as a nation to get to folks before they're sick? And then is there a good business model behind that? I think there's definitely a lot of thoughts there. But it is exciting that folks are trying to bring higher quality primary care to our sicker populations. And I think that's happening more and more every day.
Well, indeed it is. And it sounds like that you and Pop Healthcare are probably leading the way on that. So hats off to you for your efforts.
Oh, thank you. We're trying.
And so, Pat, just to look at things from a little bit more granular point of view, I'm interested in some of the numbers around Pop Health in Arizona, numbers of physicians, numbers of lives involved. I guess basically how big is the organization? Can you tell us something about that?
Definitely. So we have almost 2,000 patients, and they're all on the long-term care. We have 19 nurse practitioners who help care for these patients. So our panel sizes are small relative to a typical primary care office, but that's because of the level of acuity of these patients. Just to give you a sense, our average RAF score is quite high, well north of 2. So the patients are very sick, and so we have to, push all these resources to help take good care of them.
And your contact with the patients and the physician's contact with the patients is within an office framework or a clinic framework? Is that how that works?
Actually, so all of our nurse practitioners go to the home and have their own panel of patients. And so we visit the patients between every 1 and 2 months, and more often as needed. And then kind of my role is to help oversee the quality of care, assist with any patient issues that arise, and then kind of guidance of the overall clinical structure.
So I'm going to guess in a lot of cases, you're probably able to prevent hospitalizations and certainly emergency room visits just because these people are being seen on some sort of a regular schedule, and they don't have to worry about how they're going to get to see the doctor or the provider. The provider comes to them. Is that the way it works? That's
exactly right. So it's been really exciting to see the improvement in hospitalization rates, just as a function of good quality primary care. And so the patients know that their provider can come out to see them very quickly. And that type of relationship-based care, I think, is what's key to driving these outcomes.
Well, again, it's a brilliant idea, and I know that you must be very happy about how things are going, and it sounds like a really rewarding way to be involved in healthcare for a physician.
It is. I'm really fortunate to be part of an organization that's focused on caring for these patients.
So what I'd like to do now is move along into some of your other areas of interest. And looking over your bio, I know that you are a self-described tech entrepreneur. That's right? You agree with that? Is that true?
I think that's true, yeah.
Okay. Well, now, usually, I think when most of us hear that kind of a term, we're thinking about big ideas, huge ideas that are applied using technology. And typically, we think of people like Bill Gates and Steve Jobs and Mark Zuckerberg and other people of that sort. But I have to say that right off the top of my head, I can't think of a physician that describes themselves as a tech entrepreneur until I met you. Would you agree with that, or are there just lots of them and I don't know it?
Well, I don't know, actually. I've been fortunate enough to meet a few on my journey, so maybe they're just hidden. But it's exciting that there's a lot of physicians out there trying to make improvements in healthcare using technology, and it feels like it's kind of an undercurrent, and it hasn't maybe been brought up to the mainstream as much as it should be. But there's definitely a movement, I think, across the nation to really see where technology can be applied to help improve patient outcomes and the healthcare system as a whole.
When I was doing a little research on tech entrepreneurs, there was actually an anonymous article that I ran across. The author would not append their name to this, but the writer said that in his or her opinion, among tech entrepreneurs, there are basically three groups. There are the misfits, the celebrities, and the naivetes. The idea being that the misfits are people that just can't ever get a job anywhere, and they'll carry the fight right on to the end. The naivetes, on the other hand, are those that just kind of never know when to give up. And then you have the celebrities, I guess, like Steve Jobs and Bill Gates and Mark Zuckerberg, who begin to make a lot of money, and then they actually bow out of the development area and get into the business world. Do you see yourself in any of those pictures at all, or not?
Well, I guess I'd have to fall into, everything's a spectrum, right? So I think mainly naivete, perhaps a misfit, but I'm fortunate enough to be able to have a job as well.
Well, I don't think you've ever had problems.
My mom would have yelled at me if I didn't have a job. So
yeah. You clearly have been successful in that regard. But moving on into your technical interests, I know you have a particular product that you've been working on for a while, and I want you to tell us about that.
That's right. So I co-founded a company called Amnicam a few years ago with a really talented and good friend of mine who's an engineer. And really the whole point was to develop technology to improve labor outcomes. When I was in residency, I was on this really long stretch of work. I think everyone who's been through residency knows those tough days. And I was on a particularly long stretch, and I was managing the OB floor. And it was, I was in the middle of something like a 20-hour shift. And I was working with the nurses, and there was a shift change. And we were talking about a number of the patients who were in labor. And during that shift change, a lot of folks were reporting, dilation and effacement numbers and the status of the patient. And, the numbers were just so variable, and everyone says, well, we'll have to recheck in these things. And it just seemed to me at that time that we have to have, a cheap alternative to have an accurate assessment. That got me thinking. I didn't have the time at that point to really delve into it, but then it always really stuck with me. And I spent a lot of time researching the technologies that would, be useful in this area, looking in the patent literature. and eventually came up with an idea. But a doctor with an idea is dangerous unless you have an engineer. So you really need engineers and friends to help you execute these things.
So, and I just want to interject here to make sure that the entire audience is up to speed on what we're talking about. I know the doctors that might be listening understand that progressive labor historically has always been measured, or at least estimated, strictly on physical examination, using your hands to examine the uterine cervix in a way that is impossible to visualize, but using your hands to estimate the level of dilatation and effacement of the cervix. That's the way it's been done. So this device of yours is going to bring us to an entirely new way to approach that. Is that correct?
That's exactly right.
So how does it work?
So we looked in a lot of different ideas to try and figure out the best way to make a device work. And we put a lot of design constraints on the device. That includes cost, patient comfort. Number one, of course, is safety, accuracy, and it has to be easy to use. And it has to be that anyone in the current clinical workflow can just grab the device and use it without extensive training, which is a differentiator between things like ultrasound, which requires advanced kind of training. And so with kind of all those constraints, we came up with a 3D scanning solution, which measures accurately kind of a topographical map of the cervix and produces dilation and effacement numbers to the clinician that's reproducible.
And that the user interface on that, is it a visual thing? Is it numbers? What will the user be looking at?
It's a visual tool, and so it can be on your laptop, on your iPhone, and the cervix is shown, and it produces what we call the 3D point cloud, and that point cloud is analyzed, and then the numbers are presented to the clinician. The technology is really similar to how the iPhone scans your face, and I think that's the biggest. So it scans your face and produces. It unlocks your phone in that case, but for us, it produces numbers.
Give us a progress report. How's it going? When are we going to see it on the market?
Yeah, great question. So, the whole goal of the project is we think better data in a more patient-friendly way given to providers at the right time is going to help improve labor outcomes. And I think we all know that maternal mortality rates in the United States are very high for the amount of money that we spend. And so there is definitely a need for investment in this area. And when we talk about that, I think that's a very big subject. And we've chosen a very particular point in the whole pregnancy process to intervene. But at the end of the day, I don't know of any examples where better data given to clinicians, produces worse outcomes. So we're really optimistic that this will be beneficial to clinicians. Where we're at in the process, this has been quite a journey of international collaboration. So we've been working with engineering firms in Germany, most recently in Singapore, to produce the chips. And so we're at the point now where we have a fully functional device. We just brought on our software engineer, who's an expert in 3D imaging analysis. And we are putting all those together, and we're going to start ramping up to start clinical testing and hopefully FDA approval in the next year or so.
Well, that'd be great. And I have to say, I've been exposed to a lot of gadgets over my more than 4 decades of practice. And the vast majority of them have failed to add anything to my ability to practice medicine better. But my memories of my exposure to obstetrics, which goes all the way back to medical school, was that process of estimating the process of labor is just absolutely guesswork. And I would certainly agree that one gets better at it the more they do it. But nonetheless, as you say, there's quite a bit of variability from one observer to the next. So you have certainly identified a really important need in a significantly high-risk category of patients. And I certainly congratulate you for picking that as an area to try to improve things, and certainly hope that you continue to have success with it.
Oh, well, thank you.
Well, again, Pat, that's very interesting. And wish you all the success. That project, can't wait to read about it in the newspaper and see it on the evening news of things that I bet you'd like to see as well, right?
We're definitely going to try and make the most of it for sure.
Well, at this point, Pat, we're at the part of the program that I really look forward to the most, and that is the point where we ask our guests to give us their own personal prescription for success. So I'm going to close my mic, and we'll just listen while Dr. Patrick Vinck gives us his prescription for success.
Well, thank you again for the opportunity to speak with you today. In thinking about success, I think there's some real positive parts of it, and I think there's some dangerous parts of it. And I think there's a practical component, and then there's a component I've come to learn about that I'll share. I think practically, we're in an amazing time in the history of humanity, and I think the biggest risks we can take are not taking risks. And I think, to the clinicians that are listening, I think in general we're a pretty risk-averse group, which is good and appropriate for our patients. But when it comes to, exploring other parts of life, I think it's important that you investigate other things that make you happy and have a well-rounded life, and don't be afraid to try things. And I think, that kind of guiding principle has always helped me to find innovative roles, and also kept my eyes open as to things where I can make whatever I'm doing better. And I think the goal of everything I try to do is whatever situation I'm presented with is, to try and make that situation a little bit better than it was before. I think we can easily get caught up in what success means to us. I think there's like the materialistic sides of things. And I think those are important and play a role in life. But recently I had an opportunity to read a book which might help some folks out there called The Surrender Experiment by Michael Singer. And I think that's a really interesting book. He also has some lectures that I think are very much worth listening to. And the whole point of his approach and kind of ideology is that is really two things. One, nothing in life is personal. And two, everything in life is unfolding before us. And so, that moment is an opportunity for us to serve the moment. I think when, sometimes we go through challenges, sometimes we go through setbacks, but I think it's important to understand that everything that we do is a learning opportunity. And so there's neither good nor bad. And so I personally am challenged by this, pretty deeply. But I think it's important to take a step back sometimes and, appreciate whatever's going on and what can you learn from it. So that's kind of a new philosophy that I've kind of adopted. And I hope it helps other folks.
Well, that's a good bit of wisdom from a relatively young man, and we really appreciate you sharing those thoughts with us, Pat. It's been great to talk to you today. And before we go, I like to offer our guests to let the audience know how they can follow you. If you have email addresses or websites or social media sites where you'd like to be followed, if you'd like to share that with us right now, we'd love to hear them.
Definitely, yeah. If anyone wants to come work with us at AmniCam, we'd be happy to entertain. We have a lot of exciting stuff coming up. So I have a website, is www.amnicam.com. That's AMNICAM.com. Our Twitter handle is AmniCam LLC. And then my personal Twitter is at Patrick Vinck MD. And yeah, folks can reach out to me anytime. I'm very open. And if you're on the entrepreneurial journey, I've seen and learned a lot, so I'm willing to help anyone I can.
Well, it sounds like that you could be very helpful, and I bet you will be hearing from some of our listeners. This has been a very interesting interview, and as I said before, you're a very interesting young man and have accomplished a great deal. And once again, thank you very much for being with us today.
Thank you so much.
And that brings another Successful Prescription for Success podcast to a close. And I'd like to thank MD Coaches for supporting the podcast. You can learn more about MD Coaches by visiting their website, mymdcoaches.com. You can also subscribe to our show and glean more insight about my guests by reviewing the show notes on our website, rxforsuccesspodcast.com. That's RXFOR successpodcast.com. Please leave us a comment or a question. and I'll be reading some of those on the air from time to time. Finally, if you'd like to help support the show and gain access to members-only content, you can become a patron at patreon.com/RX for Success podcast. That's patreon.com/RX for Success podcast. Thank you so much for listening, and do please join me next time for another Prescription for Success.